Suvorexant is an orexin receptor antagonist used to treat insomnia that is characterized by difficulties with sleep onset and/or sleep maintenance. In this video, let's find found. What is Suvorexant? What is Suvorexant used for? Contraindication. What are the side effects of taking Suvorexant? How does Suvorexant work? How to use Suvorexant? What is Suvorexant? Suvorexant, sold under the brand name Belsomra, is an orexin antagonist medication which is used in the treatment of insomnia. It is indicated specifically for the treatment of insomnia characterized by difficulties with sleep onset and/or maintenance in adults. In other places, such as Australia, Suvorexant is a prescription-only medicine and is not a controlled drug. The medication is a Schedule IV controlled substance in the United States and may have a modest potential for misuse. What is Suvorexant used for? Suvorexant is indicated for the treatment of insomnia characterized by difficulties with sleep onset and/or sleep maintenance. Contraindication. Suvorexant is contraindicated in patients with narcolepsy. Side effects. The most common adverse effects of short-term use include drowsiness, dizziness, headache, unusual dreams, dry mouth, cough, diarrhea. Contraindication. Suvorexant is contraindicated in patients with narcolepsy. Side effects. The most common adverse effects of short-term use include drowsiness, dizziness, headache, unusual dreams, dry mouth, cough, diarrhea. Contraindication. Suvorexant is contraindicated in patients with narcolepsy. Dose. Insomnia. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance. Recommended starting dose, 10 mg PO taken no more than once per night and within 30 minutes of going to bed, with at least 7 hours remaining before the planned time of awakening. Use the lowest dose effective for the patient. If 10 mg dose is well tolerated but not effective, the dose can be increased. Not to exceed 20 mg once daily. Safety advice. It is a U.S. Food and Drug Administration Pregnancy Category C drug. It is unknown whether Suvorexant is excreted in human breast milk. Dose. Insomnia. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance. Recommended starting dose, 10 mg PO taken no more than once per night and within 30 minutes of going to bed, with at least 7 hours remaining before the planned time of awakening. Use the lowest dose effective for the patient. If 10 mg dose is well tolerated but not effective, the dose can be increased. Not to exceed 20 mg once daily.